Thank you. Here's what happens in nature's global plan for us. Now, you might have a hard time accepting this in the beginning, but I'm going to illustrate that what I'm saying is very, very true. And that is, if you survived infancy and childhood, looks like we all did, and you got to be a teenager, then magically during those pubescent years, new hormones were secreted and you grew this beautiful adult body. You said, look at this, you know, I can't believe I grew up like this. And my body matured, and I've got a whole new biological urge that I didn't have before. And so due to that biological urge, a lot of people end up mating. People mate. And when they mate, children come along. You procreate the species. That's how we all got. There's 6 billion people on the planet. It's how we all got here. We follow those biological urges the way nature wants us to. And so then what happens is, you know, your kids get older, you get older. Your kids get older, you get older. Your kids get older, you get older. Have you experienced this? Kids get older, you get older. And at a certain point, you know, when you're around age 40 or 45 years old, nature takes a look at you and says, hey, you did a good job there procreating the species. That's what I wanted you to do. But now it looks like your children are soon going to be self-sufficient, and so they don't really need you anymore. And you know what? I don't need you anymore either. You've served your purpose on the planet. Now you're just eating up all the food, creating waste, breathing out carbon dioxide, creating greenhouse gases. Oh, you're in the way of nature's plan. So nature has to figure out a way to get rid of you as you get to age 40, 45. It doesn't happen all at once. So built into our DNA is an aging clock. And at age 40, certain little time bombs start to go off so that there will be what? Decline, decay, degeneration. Why? Because nature wants what? Death. Nature wants death. That's what it wants. Death. You're going, can't be. Yes. Decline, decay, degeneration. Nature wants to get, nature knows if it needs it up to you. Right? Well, here's what's going to happen. You're going to say, I think I'll stick around 400 or 500 years. You know, nature can't leave it up to you. Nature has to build into the aging clock a whole program for decline, decay, degeneration, and death. That's called the aging clock. You know, as they get older, they start to lose that strength to take things out of a cupboard or put things away. This is a place where you lose a lot of muscle strength.
Right. Yep.
And it's a place where people have a lot of injuries or pain. And so this is an exercise that can really protect the shoulder. So rather than just going straight up over your head, as a lot of people do, and they've had a shoulder problem, it makes it worse, this is the natural alternative, and it hits a lot of the muscle fibers. So at age 40, your joints start to erode. At age 45, there's a power shortage. At age 50, the next thing happens. The next genetic time bomb kicks in. You say, what's happening now? The next thing that happens is that your immune and your detoxification systems start to weaken and become more sluggish. And you say, well, that's not a good thing. No, because that increases your risk of more serious infections, and it increases your risk of cancer. Cancer rates really start to skyrocket after the age of 50, as I'm about to show you. So what is the combination of herbs that all men over the age of 40 should know about? The combination is saw palmetto with Pygeum africanum, with beta-cytosterol, soy isoflavones, stinging nettle, lycopene, that fantastic carotenoid that comes from tomatoes, which protects the prostate gland, and a little bit of pumpkin seed extract. That's a phenomenal supplementation. And most recently, we're seeing that pomegranate juice, 8 ounces a day, seems to have some protective effects on prostate gland as well. So I now include in my overall strategy 8 ounces a day of pomegranate juice for men. You know, if there's just one exercise a person should do every day, it's sort of an all-in-one exercise. This is the one that they ought to be doing.
Okay.
So, and the reason why it's so important, of course, is because as people get older, they lose a lot of the power in through their hip area. So they say, what's the one exercise I need to do for my whole body and will protect against osteoporosis? Here's some advice I give to all my students. Keep your arteries open, let the blood flow. And how do you do that? Primarily by keeping your total cholesterol and your bad cholesterol within the ideal range. And I need to tell you what the numbers are, because a lot of doctors in this part of the world allow you to be at a range that's not really totally safe. I want you to have almost zero risk of vascular disease. How do you get that done? Well, from the Framingham Heart Study, Dr. William Castelli and others have shown us that people that have a fasting total cholesterol that's below 3.9 have almost no risk of having heart disease. That means 150 milligrams per deciliter if you're living in certain parts of the world. Under 150 milligrams per deciliter, or under 3.9 millimoles per liter, you're in good shape. The higher your cholesterol goes, the greater is the chance you're going to die from coronary heart disease, a sudden death heart attack, or a related vascular event. A lot of doctors in this part of the world allow total cholesterol to be as high as 5.2 before it even becomes of any concern to them. And I'm saying, no, no. How many people want to have zero risk of heart disease? Yeah, me too. So you want to be under 3.9. You know what my blood cholesterol is? It's 1. It's 1. You say, oh, you must have good genetics. No, it's because I apply the dietary and lifestyle behaviors that I'm going to walk you through right now. You want to have your cholesterol low, and my good cholesterol is 50%, 57% of the 1. It's the best ratio you could possibly have. So I'm going to show you how you can get there, or how you can get very close to those numbers. You know, so the patients I've seen, you know, they don't have the back musculature that they should have. So the spine starts to drift and shift, and they get back pain. So you really have to strengthen your back and keep it strong over your lifetime. That's why I like seated cable rows so much. I see people that are exercising as much as I do, and I exercise a fair bit. And every year they're looking worse and worse, getting bigger, fatter, bigger, fatter, bigger, fatter, and they're exercising. And they think it's their metabolism, but I can tell you it's because they're not doing all three, not putting all three foundation principles together synergistically. It's the way it has to be. You can do just one of these things and still fail. You have a stubborn metabolism, you can do 2 of these things, you still won't get results. But when you put all 3 of them together, the way I'm going to explain it to you today, the results must come because you're using the natural laws of your body's own metabolism. I've seen people lose between 20 and 40 pounds just in the first 90 days if they apply it in an aggressive way, or exactly the way I'm going to lay it out for you. On the day you're born, you have almost as many brain cells as you're going to have for the rest of your life. That's too bad because we all know people that could use a few more. I'm just saying. With fat cells, it's different. You can gain or lose fat cells up to about age 19. But by age 19, you get the total number of fat cells you're going to have for the rest of your life. Now, most people gain weight after the age of 19. They gain weight in the adult years. That's typically what happens. And so the truth is your body's actually programmed to have the fat cell size that you had at age 19. Anybody like to have the fat cell size they had at age 19? And that's what your body's actually programmed for if you use the natural laws of metabolism that I'm going to talk about today. So what I'm going to show you is using these 3 magic principles, these 3 natural laws of metabolism, these 3 foundation principles that are scientifically based, how you turn your body into a fat-burning machine and you recapture that youthful body fat and maintain it for a lifetime. You build your muscle structure with protein, as you know.
Yes.
And the best way to get the protein into the body is to have protein with some carbohydrates. Because carbohydrates will increase your insulin levels. The insulin drives the protein into the muscle and you build more muscle density. You build beautiful lean mass, it's really cut, and you raise your metabolism. Just everything you've been telling me. I think about the number of patients that have said to me, you know, as I'm getting older, my metabolism is slowing down. I say, isn't that peculiar? As I'm getting older, my metabolism to a certain degree is actually speeding up. When you do the gentle endurance activity I'm asking you to do, and you get the protein you need to rebuild your lean mass, then you actually speed up your metabolism. It doesn't slow down. You can eat more food in a day. So if you were to gain an additional 6 pounds of muscle over a 6, 8, or 9 month period, what happens is now you're burning an additional 300 calories a day doing nothing. At the end of the week, you've burned 2,100 calories just sitting in a chair. At the end of the month, you've burned 8,300 calories. Let me tell you something. 1 pound of fat contains 3,500 calories. At the end of a month, if you do it my way, you'll burn over 2 pounds of fat while you're sleeping every month. Anybody want a program like that? I burn fat while I'm asleep. So I like to get people their extension muscles back and correct their posture with this exercise called upright row.
Okay.
You see, the problem is when people go into programs like that, they're telling one part of their brain, we're going on a program. And the other part of the brain is saying, and thank God one day we'll be going off. You know, it's on, off, on, off. I say, no, no, no. I don't want you going on a program. You're not going on my program. I want you to become somebody new in this area of your life. That's how it gets done. A new relationship with food and activity. Learning how to feed your lean mass, how to shrink your body fat every day. How do you do that? How do you shrink those fat cells down? The question really is that you have to ask yourself, and ask yourself this question right now before we go any further. How are you going to look after yourself for the rest of your life? That's what I want to know. because that's the only way it can ever get done. Thank you, James. Thanks. Woo, thank you very much. Wow. You don't see that every day. Thank you very much. Thank you. Thank you, everyone.